Welcome to Middle Class Matters. Business News in English. Audit number CAG audit number 11 of 2023 on Pradhan Mantri PM Jan Arogya Yojana PMJAY. Part number 20 continues. Recommendations may be the final part. PMJAY aims at providing a health cover of Rs 5 lakh for family per year for secondary and tertiary care hospitalization of over 12 crore poor and vulnerable families. Audit noted that the scheme envisaged well-intended benefits for the deprived and marginalized beneficiaries. However, the implementation of the scheme was hindered by several issues as discussed in this part. The following recommendations are suggested for improving the implementation of the scheme. Chapter 3, Beneficiary Identification and Registration. Ministry and state and union territories may put up a suitable mechanism for identifying state-wise beneficiaries under the scheme and to weed out ineligible beneficiaries in a time-bound manner. Registration process needs to be strengthened to avoid delay in registration beyond the prescribed time. Validation checks should be in place so as to avoid invalid entries and increase the accuracy and reliability of the data. NHA may ensure that SHA set up a designated IEC cell to promote awareness about the scheme and maximize reach, impact, and awareness amongst target beneficiaries. Chapter 4, Hospital Empanelment and Management. There is a strong need to invest in public hospitals to improve and upgrade the quality of the existing health facilities in accordance with prescribed criteria. NHA, SHA, DIU may encourage more private hospitals to join under the scheme in all the districts in order to build an effective and accountable network of health service providers as per quality standards. Monitoring of EHCPs through physical inspections and necessary audits so that malpractices may get deducted and action may be initiated against the errant EHCPs. NHA or SHA should have a mechanism to monitor and curb instances involving out-of-pocket expenditure by the beneficiaries. Chapter 5, Claims Management. Processing and payment of claims must be done on time after ensuring necessary scrutiny by SHA. SHA must ensure that claim amount is utilized by government or government public hospitals for improving the overall infrastructure, functioning of the hospital, quality of services and delivery of services, and for incentives to staff. Chapter 6, Financial Management. NHA may exercise due diligence while releasing the grant to SHAs to ensure fulfillment of corresponding state commitments, actual expenditure against past releases, and also avoid idling of funds. Diversion of grant from one head to another should be discouraged, and NHA or SHA should ensure that grant is utilized for the purpose it was released. Amount due from insurance companies and interest from SHAs may be recovered at the earliest. NHA should ensure that every SHA in the state, union territories has opened designated escrow account into which their upfront share has been deposited in a timely manner. NHA must put in a mechanism to map and identify PMJAY beneficiaries so that there is no overlap of PMJAY and state-specific schemes. PFMS may be implemented on priority to track the flow of expenditure. Chapter 6, Monitoring and Grievance Redressal. SHS should ensure that district implementing units are formed in every district with adequate manpower and infrastructure for smooth functioning of scheme. Anti-fraud activities must be taken up on urgent basis and defaulters should be penalized in a timely manner. All the required audits checks must be conducted by concerned authorities in order to avoid malpractices by EHCPs so that beneficiaries may get proper treatment without undue harassment. It may be ensured that grievances are effectively redressed and corrective measures taken for improving the working of the scheme. Details of states in which hospitals were empaneled without fulfilling safety measures. 1. Bihar. Fire safety certificates was not obtained from 3 hospitals and clinical certificates were not obtained from 3 hospitals before execution of the contract. To Himachal Pradesh. Out of 23 test checked EHCPs, in 16 EHCPs, no objection certificate NOC from Directorate of Fire Services. In 12 EHCPs, NOC from State Pollution Control Board, and in 8 EHCPs, certificates of collection of biomedical waste were not obtained. 3. Jharkhand. EHCPs had been empaneled without fulfilling the mandatory minimum criteria of empanelment in 6 districts. Audit noted that SHA issued notice to one private hospital on 10th February 2020 for not adhering to the norms of the guidelines of PMJAY. However, hospital neither furnished any reply for nor SHA took any action against the hospital. The hospital continued providing treatment and got claim amount of 116.33 lakh in 1594 cases. As per the State Clinical Establishment Act CEA 2013, no one can run a clinical establishment without registration and shall be renewed in every year. Also, the Act EBD provides that the application for renewal of registration shall be made to the authority within 30 days before the expiry of the validity of the certificate for provisional registration. In 2 test checked districts, East Singaram and Ranchi, 154 EHCPs were test checked, out of which 14 EHCPs were empaneled on expired registration certificate and 54 EHCPs were empaneled without uploading of hospital registration certificate. Further registration of 4 EHCPs in 2 districts had expired after empanelment but renewed after 5 days to 272 days of lapse of registration. During expired period of registration, these EHCPs provided treatment in 386 cases and got claim payment of 0.74 crores. For Karnataka, audit noted from records of test checked EHCPs that they are functioning without required mandatory certificates or licenses as detailed below. Pharmacy license and 11 hospitals, hospital registration certificate 3, blood bank license 9, state medical council or association registration 5, ambulance registration certificate 4, fire department clearance certificate 16, PCP NDT Act registration 7, pollution control board certificate 3. Figures in bracket means number of EHCPs were empaneled without required documents. 5. Meghalaya. Out of 21 test checked private EHCPs, 2 private EHCPs, Dr. Norman Tunnel Hospital, Jovai and Tara Christian Hospital, Tara, were not registered under the Meghalaya Nursing Homes Licensing and Registration Act 1993. 6. Puducherry. Basic requirement compliances with fire safety measures was not ensured in 14 EHCPs. 7. Uttarakhand. Out of 93 test checked EHCPs, certificate in respect of fire department clearance 70 EHCPs, biomedical waste management 49 EHCPs, pollution control board compliance 78 EHCPs were not available. Non-refund of premium by insurance companies. 1. Gujarat. Oriental Insurance Company Limited, 110-2018 to 39-2019. Amount claim due for recovery from IC Insurance Company 2.12, remaining recoverable 2.12 crores. 110-2019 to 39-2020, 52.83 crores, remaining recoverable amount 52.83 crores. Jammu and Kashmir Bajaj Alliance General Insurance Company Limited, 1/12/2018 to 30/11/2019, amount to be recovered 17.80, amount recovered 16.85, amount to be recoverable 0.95 crores. 3. Ladakh Bajaj Alliance General Insurance Company Limited 1/3/2020 to 25/12/2020. Amount recoverable 0.55. Remaining amount recoverable is 0.55 crore. 4. Maharashtra National Insurance Company Limited till March 2020 214 crores amount recoverable, and amount recoverable is also 214 crore. United India Insurance Company April 2020 onwards, amount recoverable is 265.86 crore, amount recovered is 193.55 crore, amount recoverable still remaining 72.31 crore. Meghalaya Reliance General Insurance Company 1/2/2019 to 31/1/2020. Amount recoverable is 36.12 crores. Amount recovered is 31.51 crore. Remaining recoverable is 4.61 crore. Tamil Nadu United India Insurance Company 11/1/2018 to 10/1/2021. Amount claimed is 110.82 crores. Recovery is 0. Amount recoverable is 110.82 crores. Total amount recoverable is 70 crores and amount recovered is 241 crores. Amount recoverable is 458.19 crore. This is the status of this audit report, which is signed by the Comptroller and Auditor General on 1st May 2023. This is the status of this audit report, and we have to wait and watch what happens to this, what is the actions the concerned ministry is going to take on this audit report about our tax payments and tax which is being collected from us, how it is getting spent is brought out in this audit report. Thanks for watching. Please like the video, subscribe to the channel and share to as many people as possible. This will spread the information about our tax payments and how it is getting utilized. Thanks for watching.